What's up, guys? Dr. Shepard here, and I want to talk to you about highly sensitive people, what they are, and what are some signs that you might be a highly sensitive person. This is something that I actually didn't learn about at all when I was in medical school or residency. It's actually been described for a really long time, but the science behind it has been lacking until more recently. So Doctors Elaine and Arthur Aron are two psychologists who came up with the idea of the highly sensitive person. And Dr. Elaine Aron has actually written a bunch of really good books on the subject. So if you're interested in learning more, definitely consider checking them out. So the Arons first described the highly sensitive person in the 90s. In order to understand what a highly sensitive person is, we kind of have to take a step back and talk about sensory processing sensitivity. Sensory processing sensitivity is the idea that different people have different thresholds for interpreting stimuli. So it's kind of like a personality trait. And I know there are a lot of disorders that involve problems with sensory processing, and this is not what they're talking about. Sensory processing sensitivity is what is your threshold for detecting an environmental stimulus, an emotional stimulus, a cognitive stimulus. Let me give you an example. If you are a highly sensitive person, you may find that having a fan on during an exam is extremely distracting. So that would be an indicator that you have a high sensory processing sensitivity level. You're a highly sensitive person. Somebody who is not a highly sensitive person, or someone who has a lower sensory processing sensitivity, is not even going to notice the fan. And it's kind of interesting because you can be especially sensitive to any of the five senses, like physical and environmental stimulation. You can be very sensitive to emotional stimulation, like I talked about, or cognitive stimulation. It's gonna drive me nuts. Can you tell I'm a highly sensitive person? Anyways, so being a highly sensitive person does not mean that your hearing or vision, for example, are any different than anyone else's hearing or vision necessarily. So the person that's really bothered by the fan might have the exact same hearing as someone who isn't bothered by the fan. There's no difference in their ability to actually hear it, but there is a difference in their ability to process that information in their brains. And the person who is highly sensitive or has high sensory processing sensitivity is going to pick that information up more readily and think about it more deeply. So basically, to give you the short story, highly sensitive people are people who have high levels of sensory processing sensitivity, which just means how sensitive your brain is to taking in the environment around you and the emotions of other people. Being a highly sensitive person is not a disease, so I don't want you to think that. Like I said, more like a personality trait, and there are advantages and disadvantages to being a highly sensitive person. I think you'll find a whole lot of us in medicine, in the arts, in the helping professions, because we can be extremely caring people. But along with that, you'll find that we are more prone to anxiety and depression and things like that, just because we do tend to feel things a lot more strongly than other people do. So there are three terms that kind of get used interchangeably sometimes and are certainly related, but we should distinguish each of them. So what is the difference between a highly sensitive person, an empath, and an introvert? So many highly sensitive people are also introverts, and they're also empaths. So we talked about highly sensitive people as being sensitive to all sorts of stimulation, including environmental stimuli like hearing, vision, as well as the emotions of other people. Empaths are also very sensitive to the emotions of other people, and in fact, they kind of absorb those emotions, but they aren't necessarily sensitive to stimulation in the environment around them. So an empath, for example, may not notice that fan that's making noise in the background. Likewise, not all highly sensitive people are empaths, so it is much more common that highly sensitive people are empaths, but you can be very sensitive to your environment and maybe somewhat sensitive to other people's emotions and feelings, but not necessarily absorb them and take them on as your own. Introversion is also related. So Dr. Aron actually estimated that about 70% of highly sensitive people are introverts. So it's not a surprise that the two get confused. If we take a step back though for a second and talk about introverts, many people think that introverts are people who don't like to socialize, and that's just not true. Introverts actually usually love to socialize. They like to be around their select small group of people, and they may even like going to parties and being around a lot of other people. people. But the defining factor of being an introvert, as many people describe it, is that being around other people is draining for you. So extroverts actually get a lot of energy from being around other people and they kind of feed off of that. Whereas introverts, they need some time to unwind and it's exhausting to be around other people. So many highly sensitive people are empaths and many highly sensitive people are introverts. In fact, most of them are introverts, but they all don't necessarily have to go together. So I'm going to be talking about a couple of the traits that we see in highly sensitive people, and note that you may have all of these traits if you're a highly sensitive person. You may have just a few of them, or you may be someone who fits better into the categories of empath or introvert, and so some of these may sound familiar to you, but maybe the majority of them don't necessarily fit all that well. Like anything we talk about, this is something that is really best talked about with your therapist or with your psychiatrist, who hopefully can help you understand what it means to be a highly sensitive person and what you can do if that's something that's become a disadvantage to you. In other words, don't label yourself based on a YouTube video. So, first characteristic of highly sensitive people is that they need longer to unwind at the end of the day. Again, this usually relates to that introversion factor because highly sensitive people are likely to be introverts who are drained by spending time with others. They might enjoy it, but they're drained by it. You may even find that you really can't talk to your family much when you get home and you need to kind of retreat to your room, take a shower, take a break for a minute, go to the gym so that you can recharge that battery. Highly sensitive people, especially empaths, will also find violence to be extremely upsetting. In fact, they may go out of their way to avoid watching the news, watching movies with violence. They may be really distressed by it. And it can even cause you to feel physically ill or really like totally ruin your mood for the rest of the day. So I learned very quickly in my life that I had to avoid movies that had a lot of violence in them because I would just be off for the rest of the day, the rest of the week. Because no matter what I told myself, I couldn't get those images and those emotions out of my head. And I knew it was fake. I was like, this doesn't make any sense that you'd be so upset by this, but you just can't shake it. So these are the type of people that always change the channel when the commercials about animal abuse or world hunger come on because it just hurts really bad to watch it. So highly sensitive people are not just sensitive to stimulation in the environment, but also internal stimulation. So they are going to feel bodily sensations more strongly than people that are not highly sensitive. So what does this mean? It means we're more likely to have panic attacks because we notice changes in our breathing more easily. We notice changes in our heart rate. We might feel little flutters in our heart that maybe other people wouldn't even notice. We also tend to be more sensitive to pain. Interestingly enough, highly sensitive people may also be more likely to develop disorders like chronic fatigue syndrome and fibromyalgia, again, because there is some change in the way that the brain is processing sensory stimulation. Highly sensitive people also struggle with change, and you can imagine why this would be the case. If you are so attuned to everything going on in the environment around you, when the environment around you changes, it can be pretty unsettling. Highly sensitive people do really well with a routine and with a familiar environment as much as possible. Another trait of empaths and highly sensitive people, again, is this tendency to feel other people's emotions really strongly. So empathic. So this is why you see a lot of us in the healthcare professions and in other helping professions, because we feel so strongly about things that other people are going through that we want to figure out a way to fix it. This can also be a recipe for burnout, though, for those of us in the helping professions. And we can talk about later what strategies I use and what I teach my patients to use to avoid burnout when you are a very empathetic person. Feeling other people's emotions easily doesn't just relate to, when they're going through a health crisis or some sort of difficulty in their life, but also things like anger and irritability. So you may notice that you pick up on people being annoyed with you way quicker than other people would, and you may be one of those people that actually picks up on it before the angry person picks up on it. So empaths and highly sensitive people, because we are so attuned to other people's emotions, we want other people to feel good and we want other people to be proud of us. And as a result of that, we tend to be really sensitive to criticism. And that can be something that really holds us back in our professional careers, because criticism is something that's also really important for our growth as professionals and just in life in general. So we may go out of our way to address criticism that we really didn't even need to address. Maybe it's from somebody who really plays no role in our life, or somebody who's dead wrong and doesn't know anything about the thing they're criticizing. But it just bothers us so much that we've let that person down or upset that person in some way that we try and fix it. And that leads to the next point about highly sensitive people, which is that they hate conflict. We hate it. We can't stand it. We will even get anxious. Drop me a comment below if you've done this. If we see other people arguing, like two strangers that we don't know, like arguing in a store, we'll be like so freaked out by it, and you'll get like flushed, or your stomach will get butterflies. We don't even know these people, but we like hate the conflict so much we can't handle it. Which makes me wonder if there's like less highly sensitive people and empaths in law. Anyways, so when you're someone who avoids conflict to that extent, it can be really hard to stand up for yourself and really difficult to argue your point, even if your point is great and you are totally right. So kind of related to that is that people who are highly sensitive will get really anxious when they are being watched in a situation where they have to perform. So for example, an argument, if you are a highly sensitive person, you'll probably find that you're thinking up all your good comebacks in the shower, but like when you're actually talking to the person and having the argument, you're so flustered by it that you can't come up with two words to string together. But that kind of anxiety about performance goes beyond arguments. And for example, if someone is giving a lecture and is a highly sensitive person, they may be much more anxious, so much more prone to like stage fright or public speaking anxiety than someone who is not highly sensitive. Again, because you're taking in the stimulation in the environment around you, and you're also absorbing and reading the emotions of people who are in the audience. And so, if somebody yawns while you're giving a lecture, if you're highly sensitive, that's going to bother you a lot more than if you're not. People who are highly sensitive also tend to get anxious when there's a time pressure put on them. I'm not sure exactly why this is, but I know for me in particular, it ties back to that disappointment factor. So not wanting to upset other people by turning in something that's subpar or by making them late for something. Highly sensitive people tend to be pretty jumpy, so they tend to be really easily startled. These are the people that keep showing up on YouTube as the victims of pranks by their significant other who pops out behind the door and they like scream and jump up and down. Again, you're interpreting the stimulation in the environment much more strongly than someone else, so it's probably going to scare you more when something pops out at you. This is one of those things that can definitely overlap, as can many of these traits, with anxiety, depression, PTSD, bipolar disorder. In any of those disorders and other psychiatric disorders, people are a lot more easily startled and more jumpy. But the difference with someone who is highly sensitive is they've always been that way their entire life. Whereas someone, for example, with PTSD didn't start having that until they started having other symptoms of PTSD. Highly sensitive people are also going to be the ones that were described as children as being really shy or really sensitive. They're usually teachers' favorites in a lot of ways because they're so shy, they're like not very talkative, and because they're so sensitive and they try to please the teacher all the time, they maybe didn't always master the material, but they always got the good helper or always well behaved in class sent home on their report card. So highly sensitive people also tend to think really deeply about things. And when I said not everything's a disadvantage, this is one of the things I was talking about. And there are actually a couple advantages to being a highly sensitive person. But thinking deeply is definitely one of them. So we also tend to be really good creators and scientists and thinkers and inventors because we're always lost in our thoughts and our daydreams. Highly sensitive people also tend to be pretty risk averse. So you might be that friend who's always telling everybody else to buckle up when you're in the car together. You might be a little bit less likely to try substances or do dangerous things. And you just generally tend to be a little bit more cautious. So you're going to take more time to think about getting that first tattoo or jumping out of the airplane. And again, that's something that's not necessarily a disadvantage. One other thing that I really like about being a highly sensitive person, and that I think is definitely an advantage, is The fact that we really also tend to appreciate positive things even more than other people do. So we're not just sensitive to negative things like negative emotions or negative feelings or annoying sensory stimulation in the environment, like that fan I gave you as an example. We're also really attuned to beautiful things. And you might find that you're someone who gets chills when you listen to somebody sing. These are people who are so artistic and so creative and really enjoy looking at beautiful things. So these are going to be your museum nerds like me, or people who majored in art history also like me, didn't really end up using it too much. And you also tend to pick up on positive emotions in other people. So it sounds like it's all about bad emotions, but in addition to the bad, you also pick up the good. And when people celebrate things or when people have little victories, you're right there celebrating with them. So definitely an advantage of being a highly sensitive person. So there is so much more for us to talk about when it comes to highly sensitive people, empaths, introverts, all of that good stuff. And if you guys are interested in this kind of stuff, I would love to talk with you more about ways to cope with some of the downsides of being a highly sensitive person and ways to kind of harness the advantages so that it ends up being a net positive in your life, as it should be. If you like this video and want to learn more about highly sensitive people, about anxiety, depression, and just life hacks in general, definitely hit subscribe and push the notifications bell so that you are the first to know whenever I post a new video. Thanks so much for hanging with me on this, guys. I would love to hear your thoughts, and I will talk to you next time.